We're talking about hereditary breast cancer and BRCA mutations. In fact, using oral contraceptives in patients with known BRCA mutations has been shown to have some preventative effect on ovarian cancer. And I think the jury is still a little bit out on exactly what the overall effect as far as breast cancer risk in people who are carrying a BRCA mutation. But in a patient who does not have breast cancer, who wants to use birth control and has a BRCA mutation, we are not routinely recommending against it. Hormone replacement therapy is a very challenging question, and it's more complicated than just yes or no. And in fact, in the last week alone, there's been 2 major publications, and in fact, they're going to review it tonight on World News Tonight and other things. There was a large study called the Women's Health Initiative, and this accrued thousands of women across the country. And in 2003, they announced, they looked at women getting hormone replacement therapy or placebo. And in 2003, they showed that women who were taking hormone replacement therapy had an increased risk of breast cancer. That hit the news everywhere, and everyone stopped their hormone replacement therapy. As we've gotten a little bit more information, the hormone replacement therapy that has been associated with increasing your risk of breast cancer across the board in almost every study is the progesterone portion of the hormone replacement therapy. In the estrogen replacement therapy, using short-term of the estrogen therapy has not been shown to increase your risk significantly. Even more complicating of this is that women who have been postmenopausal for years and years and had estrogen deprivation, who then were given some estrogen, actually had an improvement or decreased risk of recurrence. And this is very complicated and beyond the scale of what we can do today. But the take-home message is that breast cancer or breast cells are not static. They change over time. Even a tumor, because a lot of people say, why haven't you cured breast cancer yet? This is very frustrating. You have all of these drugs and you haven't cured it yet. But when cancer spreads or goes to other places, it changes. It changes by the environment it's around, and it finds ways to resist. So a cell that's been sitting in a place with no estrogen for years and years and years may mutate and find a way to become resistant to the anti-estrogen therapy. And so what we need to do as a community is change the way that we do clinical trials. The clinical trials of old, which we did show and which Dr. Arun said got scrapped because they're millions and millions of dollars and we accrue thousands of women. With the new technology that's exploding over the last 2 years, where we can see what's going on in a cell now and do it at a price that we can actually do meaningful research, you're going to see most trials now with biopsy so we can look at these differences. So the answer is hormone therapy with progesterone does increase your risk. Short term of estrogen does not appear to increase your risk for short courses. And so far, data in people with known breast cancer who've taken hormone replacement therapy in the early stages after their breast cancer, it does show to increase the risk of recurrence in randomized clinical trials, but not in years and years and years after.